this platelet-rich plasma, known as PRP, is exactly what Selphyl is. Now you're going to say to me, hey, but what about that stuff that orthopedic surgeons are injecting into the knee, PRP? And it's now being used, I've heard, on tennis elbow. It's being used on other orthopedic injuries and sports injuries. It's the latest fad, you know. We can't get stem cells, so we can get growth factors. Let's suck the blood and let's make it. This is the only patented system that separates it in this form in a closed system and has it ready to go. It's the only system licensed by Health Canada for skin collagen rejuvenation. So, is it safe? It's been used on thousands of patients. It's been safe and effective. There have been no adverse events. By stimulating the collagen, you get a gradual increase in the volume. It's not like a hyaluronic acid filler where you inject it in and go, it bulges up, and then over time it goes down. This is a gradual, subtle increase in the volume and the thickness around your eyes, around your mouth, or where the loose skin is around it. To use other types of filler for these tear trough areas, a very difficult area to treat. I would say that we do it nicely. We have great hyaluronic acid fillers that can fill this area, but they're not a great treatment when there's loose skin. So when there's loose skin, this is probably one of the more exciting ways to do it. The immediate result is just a swelling from the fluid. That swelling goes down, and then it starts to take 3 to 6 weeks for you to start to see the cosmetic benefit. And that's why we then do a top-up treatment at 1 to 2 months and a third one after that, because it usually requires that. You don't have to have it. If you're happy with the first or the second or the third, bang, away you go. But we do recommend probably a course of 3 treatments. But the effect seems to be quite long-term, 1 to 2 years. Because at that stage, probably your aging now carries on. So the Selphyl or the PRPM has built up your collagen a bit. You've held the fort for a year or 2, but then the aging takes over and you carry on down. The areas that we use it most commonly is crow's feet, décolleté, tear troughs, neck bands, and then the most exciting is acne scars and any other divots. Actually, with this bulge over here, I would hate to have to put regular filler in there because you're going to make the bulge stand out even more. And after 3 months, the light is shining off. There's an improvement in that texture just underneath the eyes. This one as well. Those lines that happen, those little fine lines, you can't see them well. They're best seen when you're looking up in the mirror this close. Nobody ever looks that close, right? Of course, we've known of us. Neck bands. These are the neck bands before and after. And this is one treatment. This one was one treatment, 5 months after one. The 8cc kit is one syringe, one tube. Of course, you can have more. On one of our patients, we did 2 or 3, I think 3 tubes, because we did a whole range of areas. Selphyl injected in, well, this is one treatment of 8 cc's of Selphyl, improved the collagen and lifted up some of those acne scars. This is one of the more exciting areas.